Today, we're going to talk about chronic spontaneous urticaria, or CSU, and its potential connection to thyroid health, particularly Hashimoto's thyroiditis. CSU is a condition that causes itchy welts, known as wheals, and sometimes swelling, called angioedema. It can last for more than 6 weeks and significantly impact daily life. CSU is a skin condition that affects about 1% of people, often women between the ages of 30 and 50. It leads to recurring itchy hives or swelling, sometimes without an obvious trigger. For some patients, there's a potential connection between CSU and autoimmune thyroid disease, like Hashimoto's thyroiditis. This condition is associated with elevated thyroid peroxidase, TPO antibodies, and while these antibodies have been implicated in CSU, reducing TPO alone has not been shown to significantly affect the CSU disease process. If you've been referred to me, an endocrinologist, it's because your primary care provider or dermatologist found elevated TPO levels in your blood work. As part of diagnosing CSU, your doctor likely checked your complete blood count, CBC, erythrocyte sedimentation rate, ESR, C-reactive protein, CRP, thyroid function tests, and TPO antibodies. Sometimes more specialized tests or biopsy are needed for final diagnosis. While reducing TPO antibodies alone won't necessarily improve CSU, I can help manage your thyroid health alongside your treatment for CSU. 1. Hashimoto's diet. We can explore dietary changes, like the Hashimoto's diet, which might help lower TPO antibodies. 2. Selenium. Over-the-counter selenium supplements may also help reduce TPO antibodies in some people. 3. Levothyroxine. In certain cases, a low dose of levothyroxine can be used to help regulate thyroid function, even if your thyroid hormone levels are in the normal range. We'll continue to monitor your thyroid function and adjust treatment to ensure that your thyroid health is optimized. It's important to understand that CSU is not an endocrine disease. While I can assist with managing the thyroid-related aspects of your condition, you will need to continue working with your primary care physician, dermatologist, or allergist for the management of CSU itself. Omalizumab is often recommended as a second-line treatment for CSU when antihistamines alone don't work. It's shown to help many patients, but since I don't prescribe it, you'll need to talk to your primary care provider, dermatologist, or allergist about this option. Cyclosporin is a more aggressive treatment that's typically used as a second or third line of defense for CSU. It comes with potential side effects, so I do not initiate this treatment. You will need to discuss this with your dermatologist or primary care provider. Steroids may also be an option for short-term relief in severe cases of CSU, but this is another area where your PCP or dermatologist will guide you. I can certainly help you managing your sugar while on steroids. In some cases, I've found that mast cell stabilizers can help reduce symptoms. About 70 to 80% of my patients have experienced partial or complete remission using these medications, which prevent the release of histamine and other chemicals from mast cells. In summary, while I can help you manage your thyroid health and explore ways to reduce TPO antibodies, it's important to work with your entire healthcare team, including your PCP, dermatologist, or allergist, to address CSU. Together, we can explore the best options for managing your symptoms and improving your quality of life.